Ever wondered about the magic behind an echocardiogram? How it peers into the human heart, revealing its secrets without a single incision? Well, let's pull back the curtain and delve into the fascinating world of echocardiography. At its core, an echocardiogram operates on a simple principle. A device known as a transducer sends out high-frequency sound waves. These waves travel through the chest and bounce off the heart's various structures. The echoes that return to the transducer are then transformed into real-time images. This gives us invaluable insights into the size, shape, and movement of the heart's chambers, valves, and blood vessels. There are several types of echocardiograms, each suited to different needs. The Transthoracic Echocardiography, or TTE, is the most common type. Here, the transducer is placed directly on the chest, capturing images through the chest wall. Then we have the Transesophageal Echocardiogram, or T. This involves a special transducer attached to a flexible tube, which is guided down the throat and into the esophagus. This allows for more detailed images. Finally, we have the Doppler echocardiogram, which uses Doppler technology to measure changes in ultrasound wave frequency, giving us a clear picture of blood flow through the heart and blood vessels. So, how does a typical echocardiogram procedure unfold? Well, it all starts with preparation. For a transthoracic echocardiogram, there's not much to do, but for a transesophageal echocardiogram, you might need to fast before the test. Next, a gel is applied to the chest to enhance the contact between the transducer and the skin. The transducer is then moved across the chest to get different views. As it emits sound waves, it picks up the returning echoes and converts them into images in real time. If Doppler technology is being used, the technician will assess blood flow patterns and velocities. And if a transesophageal echocardiogram is necessary, a tube with a transducer is guided into the esophagus for a closer look at the heart. Now, using an echocardiogram requires specific training. Usually this is undertaken by cardiac sonographers or cardiologists. Once they've learned the ropes, they'll ensure the patient is in the right position, apply the ultrasound gel to the transducer, and systematically move the transducer to capture the necessary views. They then interpret these images, looking for any abnormalities in the heart structure, function, and blood flow patterns. So there you have it, the fascinating journey of sound waves from a transducer to the real-time images of your heart. From the basic principles, through the various types, to the detailed procedure, echocardiograms provide a non-invasive yet incredibly detailed look into the heart's functionality. This invaluable tool continues to unlock the secrets of the heart, one echo at a time.